and welcome to Cancer Help Desk and our quick cancer brief series, where we are covering common questions, concepts, treatment, and testing opportunities. I'm Rebecca Driscoll, co-founder and CEO of Cancer Help Desk. Today, we are teamed up with Dr. Lars Wagner from Duke Children's Hospital and Health Center to talk about an exciting research study, a clinical trial that is for recurrent solid tumors in people under the age of 30. And any doctor who takes care of children is a very special person in my book. Dr. Wagner is one of those extraordinary doctors. He is a board certified pediatric hematologist, oncologist, and the division chief at Duke Health. Amongst the many cancers Dr. Wagner treats, he is an expert in pediatric sarcomas, which he will tell us more about. Dr. Wagner, welcome. It is great to speak with you and talk about this fantastic study, VAL413 clinical trial, also known as Irinotecan. So Dr. Wagner, I'm very curious how you decided to choose pediatric oncology as your profession of all the things you could have done in medical school. How did you end up here?
Um, I I went to medical school to help people, and I found that the way for me to best help people was to walk alongside them as they're fighting cancer. And the pediatric patient population was really the group that I fit in the best with. That's where I felt like my skills were best suited. Boy, that has just been the best decision ever. It is such a privilege for me to get to meet patients and families and work with them as we try to tackle these difficult diseases.
Well, it's really amazing to have physicians like you who are so passionate about pediatric and taking care of children with cancer. So we thank you for all that you do in this profession, as it at times I'm sure is difficult. So let's move on to talking a little bit more about this study, VAL413, and the origin of Irinotecan. Irinotecan's been around a long time. Many children are treated with Irinotecan as part of a treatment regimen. And I know that you were kind of one of the pioneers in treating children, young adults included, with a nasty, disgusting tasting oral version instead of infusion with irinotecan. But we know that some children or young adults are either taking an infusion or this nasty drug. So how did that come about? How did you figure out, or what were you doing, with treating children and young adults with irinotecan?
Yeah, thanks. So we came across this drug, irinotecan, when I was very early in my training. Irinotecan is used for adult with colon cancer, but we also learned in the lab that it can be helpful against a variety of cancers that pediatric patients get. So various sarcomas and other tumors. And in the lab, it worked the best if you give the medicine several days in a row. So um, the early trials gave irinotecan for 5 days in a row for 2 weeks at a time. And that was helpful, but it was really inconvenient for patients. You have to come back and forth to the clinic and you have to keep your port access. So it was a real pain and difficult ask for patients to get that much treatment. And then so we tried to give the medicine orally instead, which was definitely more convenient and patients could be at home as they're doing that. But there wasn't a tablet formulation of irinotecan. So then we got stuck with just giving the IV preparation that we were administering intravenously through the port. Well, to take that by mouth. And as you point out, it's pretty nasty tasting. You can mix it with cran grape juice, and that may help mask the flavor a little bit. But the problem is the more that you mix to mask the flavor, the more you have to drink. And so it for some patients, this was just a real deal breaker. And so that leads to the current situation. We've got a medicine which can be helpful for many patients, but you either have to do it IV administration for at least 5 days in a row with all those inconveniences, or the oral irinotecan with the big taste issues.
Great. So thanks for that explanation on irinotecan itself. Now I'd like to get a little more specific on orotecan, this val 413 or 413. clinical trial and kind of the significance behind this, because this is kind of a unique study and a great opportunity for families and patients to have an opportunity to access this medication that could really change their quality of life. And I know we'll talk a little bit more about the specifics around quality of life, but would love your perspective on just Orotecan and Val 413.
Yeah, thanks, Rebecca. So a few years ago, I was approached by a drug company, and their goal was to make a better tasting oral irinotecan preparation, which I thought that's awesome. And I wanted to help that because irinotecan is being used for more and more pediatric cancers. This is really something that can help a large number of pediatric cancer patients. So they came up with this product, the Orotecan or Val 413, which is basically a way to flavor the IV irinotecan, so it's much easier or more palatable to taste, to take, and so better tasting than trying to mix it with cranberry juice. But you can't just kinda mix stuff together and start using it without doing some type of testing, and so that's the one of the purposes of this clinical trial is to make sure that mixing the medication, with to create the Orotecan product provides the same amount of irinotecan as what patients were getting in other ways. So we want to make sure this is equivalent or, provides the same benefits against the tumor as taking the irinotecan the other way. We know that if you give irinotecan IV, the number of milligrams is a little bit less than what you have to give in terms of giving it orally. And so we've done those conversions and we've figured out doses that are equivalent between the IV and the oral with the clean grape juice. And now what we're trying to do is to make sure that adding the flavored agent with the Orotecan, that those drug levels are the same. And we also want to make sure that this indeed does taste better. This is something that patients are able to do. So those are some of the purposes of the clinical trial.
Awesome. That's so helpful as far as understanding what exactly, is Orotecan. So thank you for that description. So let's move on to the types of cancers that this study, and Orotecan can be used for. You're a sarcoma specialist. I know that you see a lot of Ewing sarcomas patients. Osteosarcoma is another one, and there's several others. So could you just give us a little bit of understanding around what are some of the other recurrent solid tumors that could be on or Irinotecan if they're currently taking Irinotecan or it's being suggested?
Yes, a couple other sarcomas, rhabdomyosarcoma is a drug for which irinotecan can be helpful. There's a unusual type of tumor called a desmoplastic small round cell tumor that we usually see in teenagers and young adults, and irinotecan can be helpful for that. There's some other, tumor types that irinotecan can also be beneficial for. Neuroblastoma, which is a disease mostly of little kids in the first decade of life. Irinotecan can be a big part of treatment for recurrent neuroblastoma. And then there's other tumors, kidney tumors like Wilms tumor or brain tumors like medulloblastoma for which irinotecan can be helpful. So when you do the math, this comes out to about almost 1 in 4 pediatric cancer patients, could be eligible for treatment with irinotecan, especially for patients that have had recurrent tumors.
It's great to know that so many of these different cancers, have benefited from Irinotecan and can also, benefit from Orotecan. So thanks for sharing, all the different types of cancers that, could, you know, have the opportunity to have Orotecan. So the next question I have for you is around quality of life. This is such a big deal, and especially for younger families and children where the whole family or, parent has to take the child to the hospital and be with them for infusion multiple days in a row. Or I can't even imagine trying to get a sick child to drink a medication that is awful. just these various scenarios that really hinder the quality of life. So, could you tell us a little bit about, the change of quality of life that could happen, with going on this study and taking Orotecan?
Oh, absolutely. We usually give our Irinotecan at least 5 days in a row. And, it's one thing if you live 5 minutes away from the treatment center, but most of our patients do not live that close. And there's all the back and forth. Irinotecan IV is a 90-minute infusion. So you're kind of hanging out each day, getting this infusion. It's not a real quick thing. And it does wear on you, especially for patients getting multiple cycles. And this is one reason why we developed oral irinotecan in the first place. And it's one reason why I'm so excited to try to get a better tasting product, right? That's something that patients can really do for multiple cycles at home in a much better setting, and something that's more feasible to do for a longer period of time.
Gosh, the convenience of at home medication. I mean, who doesn't want that? And that is absolutely an incredible benefit of doing a study like this. So there's other criteria. There's always criteria for how people can participate in a study. And I think it's important for us to talk about, what is some of that criteria? Like what enables somebody to participate in this type of study for getting the Orotecan medication. Can you talk a little bit about that?
Yeah, thank you for mentioning that, because it is important. The criteria to get on the study are pretty strict for any clinical trial. You can't kind of fudge them. You really have to meet all the criteria. For this particular trial, though, it's what I would consider user friendly, meaning that it is able to take on a wide variety of patients. And in particular, if your treating physician feels that irinotecan and temozolomide is a good combination for your care, then that's one of the main criteria. That's you've had a cancer, it's come back, and irinotecan and temozolomide would be a good part of your treatment regimen. You can also receive a medication called vincristine, and that's sometimes given with the irinotecan and the temozolomide. One really important part is that you don't have to have a lot of tumor present on the scans. That's different than many clinical trials in which you have to have a certain amount of tumor or else you're not even eligible for this. The purpose of this study is to see if patients can tolerate this new form of irinotecan better than the old one, and that it gives the same drug levels. So the goal for the patient is to treat the tumor. That's the goal for the physician as well. But one of the main objectives of the study is to make sure this oral preparation of irinotecan gives good drug levels, and that we're using the right product for this. So it's not required that you have to have a whole bunch of tumor. You just have to have a recurrent solid tumor that for which the irinotecan would be a good fit and make sense from your oncologist.
So, on the other side of the coin, then, what would prevent somebody from going on this particular study? Is there anything that would make it to where they couldn't qualify, let's say, to get on this clinical trial? Can you talk about that a little bit?
Yeah, the things that would prevent you are going to be from enrolling on the study are also things that your doc is probably not going to want to give you the irinotecan and temozolomide anyway, right? So if, for example, you had received it before and your tumor had gotten worse while you're receiving it, then maybe going back to do this study would not be the best fit, and that would make kind of common sense. If your organs are not working appropriately, like your kidneys, your liver is having a lot of difficulties, now may not be the best time to be on that study. And that's typical of most clinical trials. But those are the main reasons why someone couldn't do it. And so the study does allow prior treatment with temozolomide and irinotecan as long as the tumor never got worse while you were getting those medicines.
So good to know, Dr. Wagner. This sounds like a study that's really easy for somebody to get on, given the criteria that you've mentioned? And it's, often not very flexible. It's not easy for people to get on study. And so that's pretty exciting that this is a fairly straightforward and easy study to get on. So, one of the things that comes up often is concerns around changing therapy in the middle of treatment regimens. Um, Given that this particular medication is essentially similar to irinotecan, except for tasting better, which is a great thing, and quality of life at home, um, can you tell us a little bit about, you know, any concerns or, the ease of going from, the current irinotecan infusion or the nasty oral med in the middle of treatment to moving on to orotecan in this study? Is that easy enough to do? And is that okay? And can you talk to us a little bit about that?
Yes, and that's a real important point to emphasize, and we've even done that with a patient here at Duke who had gotten several cycles of the orally administered irinotecan with the Korean grape juice, and then when he heard about this study, he wanted to enroll on this as a way to provide that same outpatient oral treatment and hopefully a better tasting thing. So you can certainly have been getting prior cycles of irinotecan and temozolomide. As long as the tumor was not getting worse, then you would still be eligible.
Well, that was so helpful, Dr. Wagner, because that is definitely a concern that we have come across, whether or not changing therapy in the midst is okay. And there's a lot of concerns around that. But what I'm hearing is that people shouldn't be concerned. Parents, young adults, they shouldn't be too concerned because this is essentially the same medication, but a much better palatable version that can change their quality of life. So, pretty exciting. And this is why Cancer Help Desk decided to really get this information out there because people need to know what exists for them, what options are out there. And when it comes to quality of life, time at home, time with your family, first and foremost, we think that that is essential. It's an essential part of life. And people should be able to enjoy that, especially when they're dealing with a cancer diagnosis. So I want to thank you. Thank you for your time and being here with us and helping us understand what this study is all about, helping us get the information out to families and patients and those who may be caring for a loved one dealing with this type of recurrent pediatric cancer. As a reminder, Cancer Help Desk is a 501(c)(3) nonprofit whose mission is to provide resources and choices, education, options to those that are dealing with cancer. And if you want to get a hold of us, you can find us at our website at www.cancerhelpdesk.org, or you can call us at 888-454-0804. Please share the word about Cancer Help Desk, family, friends, anybody that may be dealing with a cancer diagnosis, and can use our expert team of navigators, PhD scientists, our resources like Dr. Wagner and others to support them in dealing with their unique situation.
All right. Thank you so much for having me, Rebecca. I appreciate it.